The main issue before the population is whether we believe it, we give credence to what we hear or not. What do we believe, what we do not believe. Now, the statement that comes to you, a doctor might be telling put saline in your nose and it might be all right. And he might be honest. He would have seen 20 patients and 19 or not benefited from it. But it still could be by chance. I don't think it requires much explanation that if you toss the coin up, you may get hit 5 times out of 6 and it could just be a chance. Or it could be bias. It could be something called confounding. Both of this I will explain in the subsequent slides. Reverse causation is something else altogether. Reverse causation means you may think that, look, I am getting many studies have shown that the B complex level in the COVID patients are low. Therefore, I give B complex and the patient becomes all right. It may be the other way around. The pathology in the COVID might be causing the low whatever minerals or vitamins you are measuring. I'm just giving you an example. And now these things, reverse causation, I will not go into in details in the subsequent slides. Causation, he might be honest. What he's telling may be right. When he says that saline will give you a benefit from protection of COVID, it could be right. And that's how do you know whether it is right or wrong? That is a reason before us. That is a problem before the population. Now, the most likely reason for this is that whenever people tell you this, it could be a placebo effect. Now, what is a placebo? I will come to in the next slide. Placebo in Latin simply means that I shall be pleasing. Now, placebos are substances that are made to resemble drugs but do not contain an active drug. They contain inert substances like starch, yeast, etc. And they are not supposed to act. But surprisingly, many of the patients, many people get benefit from placebo. It may be a bit of surprise to you that placebos do act, but it is a fact. In fact, in the Second World War and the First World War, in many times in the remote places, you would find that the morphine went out of stock. And many times the nurses and the doctors injected distilled water and did a very painful procedure like amputation. And the patients felt less pain. Similarly, it is well known even today that if you have migraine, I give any medicine and tell you that if you take this medicine regularly, your migraine will become less severe. 50% of the patients come back to us with placebo, with benefit. How does it act? There is a lot of explanation for that. But the most fundamental thing, how it acts, is the patient expects the drug to act. Therefore, when you have expectation, there are a lot of explanation how your pain, your fever becomes less than as expected. This might look really surprising, but it is a fact. It seems to be acting at the level of the brain at some times itself. When you give placebos for pain, they have found out that there is an increased secretion of opioids. And when you give it for Parkinsonism, where placebos are known to decrease the tremor at times, there's an increased secretions of dopamine. Therefore, this placebo effect is a scientifically accepted fact, and there seems to be some physiological explanations also for that. Some of the other interesting facts about placebo is the capsule seems to be working better than tablet form. Injections work better than capsules. And even having a nice talk with a doctor before taking a placebo can increase its effect. This all shows the effect of psychological factors in the well-being of the patient and the benefit you get from whatever treatment you take. Even the color of the tablet you take, the packaging, etc., has a placebo effect on the patient. That's why you will find some old patients, if they are given a different product with a different packaging, they are not happy with it. But please remember one thing, that placebos may decrease the pain, may help you slightly elevate the fever, but it will have no benefit in the sense that it will not cure your COVID, it will not cure pneumonia, it will not cure dysentery. in which only real medicines will act. That should be very well known to you. And when a doctor tells you, in my practice, I have seen such and such a drug very effective, but I have no proof from studies done anywhere, you have to take it with a pinch of salt, however experienced the doctor might be, because the placebo effect might be kicking in. Now, the next factor that is important is bias. Bias is any systematic error in the epidemiological study that results in an incorrect estimate of an association between exposure and outcome. I will explain it in the subsequent slide. Bias does not mean that the person is cheating. Remember that. To give you an idea of what bias is, there are two types of bias. One is called the selection bias. I would explain this to you in a simple way like this. If a doctor is working among the healthy workers, like he's treating in a factory workers who are generally healthy than the general population, and he sees many COVID patients, he might likely to tell you, like, look, the COVID is a very minor illness. It doesn't cause any problem to you. At the same time, you meet with a doctor or nurse who works in the ICU. He or she will tell you that that COVID kills 50% of the patients die. Therefore, the opinion depends on whom you see also. So this is a systematic error which happens by how the participants are chosen by the person who giving you your advice. The other problem that often happens is information bias. I'll just take one thing, the recall bias. Many times what happens is senior doctors like us always believe that we are great. Most of our patients are happy with us because whenever we give treatment, they come back and say they are better. But the problem that is, when they come back and we ask them, last time you came to me, how long the fever lasted, he may not remember that completely, but he might say, just one day, doctor, just to please me. Therefore, this is a recall bias that can happen. And the other problem that can happen is patients who were unhappy with you wouldn't have come back to you for follow-up. If I might think my treatment works, the doctor might be very honestly thinking that everybody whom he puts saline in the nose never gets COVID. But the patient who gets a COVID may be angry with him and not come to him. Therefore, these causes bias in the assessment of the doctor regarding that particular illness. Other than bias and placebo effect, something else which can distort your judgment is confounding. Confounding is a situation in which the effect or association between an exposure and outcome is distorted by the presence of another variable. This may look very complicated, but it will be very easily explained in the next slide.